This video shows how to do a self-lymphatic massage for lymphedema after breast cancer. This is one of the strategies that helped me the most for lymphedema. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. If you haven't watched the video detailing what to expect with lymphedema, I've linked that in the description below. For this video, I've enlisted the help of my own lymphatic massage therapist, Susan, to go through the exact steps to follow. So we're going to start off with a Q&A about self-lymphatic massage and then stay tuned for the demonstration of the steps after that. If someone were doing it start to finish, how long would it take? And then obviously it'll depend on how much of the routine they do. So yes. I didn't have lymphedema in my arm and I had it sort of breast, chest, side of the torso. So I only did what pertains to that and didn't actually do my arm.
Right. It will depend on, as you said, the areas of the body that are affected and the severity of the lymphedema. If somebody were to do the full routine, it might take them 30 minutes.
Okay.
The more you do it, the more comfortable you and more proficient you become at doing it. And so for some people, they spend as little as 10 minutes, 10 or 15 minutes. Other people might need to spend longer.
Okay. Yeah, I think when I was doing it, it was probably about 10-ish minutes. It was probably maybe 15 minutes at the beginning, and then as I got more comfortable, I was able to, I don't know, just streamline that a little bit more. How often would someone do this? This will depend on where they are in their journey, right?
Yes. I like to tell people that whatever they do is going to be better than doing nothing. And we need to be realistic about what somebody can reasonably fit into their life.
Right.
So I don't want to create a lot of stress by saying people have to do it this many times. If they can do it 3 times a week, that's going to be great. Occasionally, I'll even suggest to somebody, particularly at the beginning when our goal is to reduce, if they can do it twice a day, morning and night, that would be fantastic. That would be our ideal scenario. But again, whatever they can do is going to be better than nothing.
When I was doing this, I think I started at daily at the beginning because I was so annoyed with this symptom. And I wanted to, you know, like how I do, throw everything at it. And then I was just doing it really frequently to see if I could reduce that a little bit quicker. And then I think as I was starting to see improvement, then I reduced the frequency so that, you know, I had all the other things that I was doing for, let's say, cording, radiation fibrosis, all the exercises. So sort of the priorities changed as my symptoms changed with lymphedema, I think. The other times, just because I was trying to do this so frequently, we would maybe be in the car going somewhere and I would be passenger, obviously not driver. And while my husband would be driving, I would just like under my shirt, do the whole routine when we were going somewhere, just because if you can sort of stack things, it makes it a bit more convenient and it happens a bit more frequently that way.
Yep.
If someone's had breast cancer surgery and has lymphedema, they're obviously going to do this routine. How about if someone had breast cancer surgery, doesn't have lymphedema, would they still do this routine?
They don't have to do the routine. It may be beneficial, again, as a way of monitoring so that they can watch their body and see if there are any signs of onset of lymphedema. It certainly can help support the lymphatic system and keep the lymphatic pathways open and may help reduce the onset of lymphedema.
If someone has a port in, is there anything differently that they would do, like in terms of a modification to the routine?
The port is very securely embedded just beneath the skin with the catheter threaded through the veins. Certainly, I wouldn't massage directly over the port itself.
Yeah, that's what I was wondering.
So you could easily go under and around it and simply avoid, give the port a little bit of space.
Okay. Is there a certain sort of order that you go through?
Yes, very much. We always start with the neck. And the reason for that is because the lymphatic system is a one-way system that draws fluid out of the tissue, up through the lymphatic vessels, through the lymph nodes where the lymph fluid gets cleaned and filtered. And then in the neck, just above the collarbone, this is known as the terminus or the end of the lymphatic system. And that's where the cleaned lymph is put back into the blood vessels. And then we work backwards down this one-way system, but always directing back up. In the case of someone who's been treated for breast cancer, we then go to the armpit. And that's because the lymphatic system is divided down the middle of the body, with this side of the trunk and arm naturally draining towards the lymph node basin that's in the armpit.
Which for women with breast cancer, that's where lymph nodes were removed.
Yeah, some have just the sentinel nodes, which can be 2, 3, maybe 4. Some women have had 6, 10, 15 lymph nodes removed.
Right.
Also, if they've had radiation to this area, the radiation also damages the lymphatic system.
And the lymph nodes up here too.
Yes.
Often. Yeah.
If there's swelling in the top of the chest, the breast, or the side of the trunk, we then direct over that area into that armpit.
Yeah.
Or perhaps only to the other or in addition to the other armpit.
Right. Right.
And we can then get into the arm then, and either, if it's not too serious, into the armpit or away from that armpit over the top of the shoulder and into either terminus accordingly. This is a clinical decision that somebody will make with their lymphedema therapist as to exactly what order they do the lymphatic drainage. As advancements in treating breast cancer evolve and women have fewer lymph nodes removed and the damage to the lymphatic system is less
Compared to before.
compared to 10, 15 years ago,
Right.
then the lymphedema, the severity of the lymphedema is much less. There is new research showing that even after treatment for breast cancer with the different things we've discussed, it is still better to direct the lymph towards the affected armpit.
Right.
And so this is a clinical decision that we'll make, as I said, based on treatment, side effects, and the stage of the lymphedema.
Initially, I was taught the routine from an OT at the hospital and then had a handout, and then that showed directing away from the cancer side underarm area. And so when I started seeing you a number of weeks later, because I didn't know about you at the beginning, then we had a chat about this, and then I actually switched to start directing towards the underarm area on the cancer side, because for me, that made sense. Like it was appropriate for me, but like you're saying, it may not be for everyone. It just depends on their case.
I think there can be benefit in trying to keep the lymphatic system in the affected area active.
Right.
There are 30 to 50 lymph nodes in the armpit area.
Yeah.
So if somebody's had 2, 3, 4 lymph nodes removed, that's not very many.
Right.
However, there is no direct correlation between the number of lymph nodes removed and the severity of the lymphedema. There's an element of mystery.
Yes, because there's so many other factors, right? If someone had radiation or, all these other sorts of things. Yeah. Okay, so in terms of the steps, let's say how you were describing, there's that order that you're going to do things. If someone, for some reason, goes out of order or they're just not doing everything exactly as recommended, can they make things worse?
I don't know that they would make things worse necessarily. They just might not be as effective in the self-lymphatic drainage.
Okay.
It doesn't make sense to, for example, start with the neck and then jump to the hand, because you haven't stimulated the other areas of the lymphatic system that are between the neck and the hand.
That would clear into.
Yes. Sometimes I use the analogy of traffic with my patients, and I say, you've got a lineup of cars stopped at a red light. The cars at the end of the line can't get moving until the cars at the front of the line get moving. So let's get that car out of the way, and then we'll get this car moving, and then we'll get this car moving.
Okay.
And that also demonstrates how we work backwards down the lymphatic system, but always directing up.
Right. Let's say someone starts this routine. How quickly after they start can they expect to see some results?
They might start to see results right away, which is really encouraging. It shows that the lymphatic system just needs a bit of a boost and a bit of support in order to function properly.
Yeah.
For other people, however, they might not see results, and that can be really frustrating and sometimes dispiriting. And it speaks to the fact that there's a mysterious element to lymphedema, and it's multifactorial. The causes are multifactorial, and therefore our management approach has to be multifactorial.
Right, right. I was pretty lucky that I did notice a difference right away when I started, but it wasn't like I started doing the self-massage and then like I was good to go, all gone. It was, I would do it, and literally that day I would notice that, oh yeah, it actually, I can tell there's less of that sort of full feeling. I could even see a bit less of the swelling, but then it would like dip down after I did the routine, maybe the next day, that sort of thing. But then it was always sort of up, down, but it was trending up over time.
Yes.
And so that's why I was pretty consistent trying to do this so often at the beginning, because I really did notice a difference. it was still frustrating because it was like many, many, many months for things to settle.
And it depends how far out from your treatment you are, because for the first 6 months, the physicians are reluctant to give you a lymphedema diagnosis because it could just be post-surgical swelling.
Right. Yeah, and so I definitely had a bit of post-surgical swelling. It was not even on the side that had cancer. It was actually, because I had a double mastectomy, it was on the other side. I had tissue expanders put in. It's different. Like the swelling from surgery just feels very different than lymphedema type swelling.
That's interesting, yeah. And the manual lymph drainage, the lymphatic massage, will still help with the post-surgical swelling.
Okay. Oh, that's actually good to know too. Are there any times where someone shouldn't be doing a self-lymphatic massage?
Yes, if somebody has an untreated infection. With lymphedema, people are at a slightly elevated risk of developing cellulitis, which is an infection of the superficial tissue. If somebody comes to me and says they have been diagnosed with cellulitis and they've started antibiotics, I want to wait at least 24 hours, maybe 48 hours before I do the lymphatic drainage. And it's because I don't want to spread the infection to other parts in the body.
Okay.
But once they are on antibiotics, I'm happy to do the lymphatic drainage.
Yeah. And then they themselves, if they were doing their own routine, they should be okay to do it at that time point.
Yes.
Okay.
Another time when somebody should not do lymphatic or modify their lymphatic drainage is if they have open sores. So if, for example, they have open sores from the radiation, they should not be massaging directly over that until the area has really healed and the integrity of the tissue is stronger.
What's the difference between, let's say, me doing a self-lymphatic massage and then me going to see someone who does a lymphatic massage?
A therapist might be able to do it more easily and more thoroughly than you could do on yourself.
Sure.
But it's not feasible to go to a lymphedema therapist every day or twice a week or even once a week. Some people are able to go once a month or less often.
Right.
So knowing how to do the lymphatic drainage on yourself is an excellent thing to fill in between your appointments with your therapist.
Right. Let's get into the steps.
I'm going to demonstrate how to perform lymphatic drainage on yourself. The exact routine will depend on your individual needs, and so this should be discussed with your lymphatic therapist. You want to find yourself sitting in a comfortable and warm position where you can relax. This might be propped up in bed. You can do it sitting or lying. It might be in a comfortable chair or couch in your living room. You can do this while you're watching TV or at some time in the day when you can relax and take your time with this. The pressure should always be light. Remember, we don't want to compress the delicate lymphatic vessels that are just beneath the skin. And the pace and the rhythm should be slow. We want to mimic the natural pulsations of the lymphatic system that propel the lymph through the lymphatic vessels. We always begin with the neck, which is step 1. You can cross your hands and work on both sides of the neck at the same time, or if you're more comfortable, you can do one side and then the other side. You're going to keep your hands in a relaxed, natural position, and in order to maximize the surface area, you want to use the full length of your fingers, possibly even the full length of your finger and partway down into your palm. You want to stretch the skin, so keep it light. Place your fingers just below your earlobes, and you're going to stretch the skin in a semicircle direction towards the back and then down into the terminus of the lymphatic system. This is the area just above the collarbone. So here I go. Fingers below the earlobes, gently stretch the skin towards the back and down towards the terminus. Ride the skin back up and do that semicircle again. So you do the semicircle a total of 5 times. You then switch to using your 2 fingers on the top of your shoulders, and you do a little curve, drawing the fluid down into this terminus, stretching the skin from the top of the shoulder down into the terminus. You do that 5 times. You then repeat those 2 steps, the neck and the top of the shoulder, 2 more times so that you've done each one a total of 15 times. Step 2 is when you open up the lymph nodes in the armpit. Whether you direct the lymph into the affected side or the unaffected side will depend on a number of factors that you'll discuss with your lymphedema therapist. You'll take into consideration the severity of your lymphedema, the number of lymph nodes removed, whether or not you've had radiation, and if you've had any complications following treatment, such as infection, cording, seromas, skin blisters following radiation, etc. Using the opposite hand, again do a semicircle starting on the side of the trunk underneath the armpit. So it's light pressure and slow, stretching the skin in that semicircle, and once again you're using the full surface of your fingers and your palm. You're not using the tips of your fingers. 5 circles on the side of the trunk into the armpit. You can then switch and work more directly in the armpit, going down into the armpit and pulling it back, the skin back up. And again, you repeat those 2 steps 2 more times for a total of 15 in each position. If you and your lymphedema therapist want to do the unaffected armpit as well, or perhaps you've only done the unaffected armpit, you do exactly the same thing, but with the opposite hand. Flat fingers in hand, relaxed, stretching the skin in a semicircle from the side of the trunk up into the armpit, and then more directly over the armpit, down and up. You do that 5 times in a light and gentle and slow rhythm, and then repeat those steps 2 more times for a total of 15 semicircles in each position. Now that you've stimulated the lymphatic system in the armpit, where you have this basin of lymph nodes, you then can move to one of 2 areas. If you have swelling down the side of the trunk or over the breast, you can start to do lymphatic drainage over those areas of swelling, directing up into the armpit that you've already prepared and opened to receive the lymph. If you have lymphedema on the side of the trunk, just as you've been doing, you're going to be using the flat surface of your fingers and palm, keeping it in a relaxed, natural position, and you're going to do semicircles on the side of the trunk coming up into the armpit. Some people like to think about this motion as a windshield wiper motion, so that it looks a little bit like this on the side of the trunk. You can do 5 circles in one position, move up closer to the armpit for another 5 circles or semicircles, and repeat that 2 more times for a total of 15 semicircles. If you have swelling in the breast, you're going to start with the side of the breast because it's closer to the armpit, and you're going to do your semicircles using a flat, relaxed hand, fingers and palm into the armpit. You may need to also work on the medial side of your breast closer to the center of your body and bring that over into the armpit. But you want to clear the side of the breast closest to the armpit first before you start moving fluid that's farther away from the armpit. After you've opened up the unaffected armpit, if you're choosing to direct the fluid towards the unaffected armpit, you will want to stretch the skin across the chest from the affected side to the unaffected side. Some people like to do it this way, so that the hand and the arm is in a fairly neutral position, stretching the skin and the pressure is light and the rhythm is slow. Some people use their fingers and palm in this windshield wiper motion, and they do it like this. If you don't have lymphedema in the side of the trunk or over the breast, but you do have lymphedema in the arm, you can skip the trunk and you can go right to the arm. Here again, I'm going to say that it will depend on the severity of the lymphedema to determine whether you're going to direct the arm right into the armpit or whether you're going to direct it over the top of the shoulder and into the terminus. If you're going to direct right into the armpit, you can, now you're using more of a scooping motion, engaging the palm here between the fingers and the thumb. And you're going to do a bit of a scooping motion directly into the armpit on the underside of the arm. If, however, you want to avoid the affected armpit, you're going to stretch the skin, again using a soft, relaxed hand and more of a palmar surface than a finger surface. And you're going to stretch the skin from the inside of your arm towards the outside of your arm. And you're going to do that 5 times, and then move down the arm to a lower section of the upper arm, stretching the skin from the inside of the arm to the outside of the arm. You're then going to use the same kind of hand position and movement and stretch that skin over the outside of the arm, over the top of the shoulder, and into the terminus. So you can do the same sort of thing where you're stretching the skin but directing it into the terminus rather than directly into the armpit. There's very little that you can do wrong here, so don't worry about feeling that you have to get it perfect, that you have to do it exactly the way I do or the way another therapist does. Whatever you do is going to be better than doing nothing. And reassure yourself that you're helping yourself and doing a lot of good things. It can be very beneficial as we move down the arm to address around the elbow specifically. Sometimes people can have a lot of filling and it fills in these little indents between the elbow bones. And so bending the elbow and getting in with your fingers around those elbow bones can help move the fluid out of those specific indents in your body. Then you can move to the same motion and hand position we've already been using. Relaxed hand, palmar surface, and you're going to do this scooping motion over the elbow. Straightening and bending your elbow while you do this over the elbow can be beneficial because you're opening and closing the joint. And you're also engaging that muscle pump action that helps move the fluid. You're then going to use the same kind of motion and come up the forearm from the wrist to the elbow on both sides of your arm, focusing if there are any particular areas of swelling. If you have swelling in the hand, to provide lymphatic drainage on the back of the hand, you're going to switch to using the flat of your fingers because your hand is a smaller surface. So using the flat of your fingers with a relaxed natural hand, you're going to do this windshield wiper motion or these semicircles over the back of your hand from your knuckles to your wrist. You do this 5 times or repeat 2 more times for a total of 15. If you happen to have swelling in your fingers, using your finger and your thumb, you can do that same kind of motion over the sides of the fingers as well as over the top and the bottom of the finger from the tip of the finger towards the knuckle, doing each finger individually. Once again, we do our motions in sets of 5s, repeating that set 2 times for a total of 15.
Let me know in the comments below if you tried out this routine and how it helped. As with many other types of treatment or rehab, doing a little bit consistently is always better than doing a lot infrequently. Hit that like button if you found value in this video, and we'll see you in the next one.